Hi, this is Dr. Konstantin. I'm a facial plastic surgeon and a facelift expert, and I'd like to talk to you about some very important topic today. The question of the day is whether a face and a neck lift will get rid of the muscle bands in the neck. And the reason why I want to bring it up because I recently had a patient who is terribly upset. He came back after his facelift and everything looks great, but he does have those like little bit of a bends in the neck that he can see under certain circumstances, and he's very upset. He feels that his facelift was a failure. Now, will a face and neck lift get rid of those muscle bands or not? Now, the answer, of course, is a bit complicated. The answer depends on what type of muscle bands the person has. So there are two different types. One is called static, another one is called dynamic. And don't worry, I'll show it to you in a picture and it will become quite clear. So the static bands are the ones that just come with age. It's when the neck starts sagging and you see two of those ridges in the neck. Those are the sign of age, and those are the ones that we can get rid of quite easily with a facelift, which include the neck. Now, the dynamic bands are the ones that are visible only when the person is moving, when they speak, and the muscle is active. Or sometimes you can see them at rest when the muscle is just have a very strong tone. And those are typically not the sign of age. A lot of younger people have this very active platysmal muscle in the neck. And the facelift doesn't really do much with it. It can sometimes make it a little better, but really not significantly. So now the only treatment for those other type of bands is Botox. And this is unfortunately something that one would have to do continuously and just adding some Botox to the neck. Now, the good thing about this type of treatment is that you don't really need to do Botox very often in the neck. Maybe once a year or once every 6 months would be quite sufficient to keep those tiny bands at bay. Now, I oftentimes tell people, why bother? If this is not the sign of age, just leave it alone, and it will be perfectly fine. And a lot of people don't worry about it because they still feel like, I look good. Why should I bother about just a couple of tiny bends in the neck? Others who bothered by that, Botox is a perfect solution. Now, let me show you a picture that would explain much better why there are different types of bands and why some of them go away with a facelift and others do not. This is a picture of the patient, and this is on my website, so you guys welcome to look at this one. So you can see how this neck has a bit of an extra skin here, and the muscle here behind that extra skin is called a static band. Now, with the facelift, you see how the neck contour looks very nice, but at the same time, there's still a little bit of a hint, right? Like right here, there's just a little ridge here. And that ridge is something that we cannot get rid of with the facelift, at least most of the time. This is something that's called a dynamic band. Now, the same patient here, and you can see right over here, there's that muscle ridge, which is called a static band. So this is a platysma muscle that began to sag and became a little loose, and we got rid of it, as you could see on the side view. At the same time, you will see that hint right behind the skin. There is a hint of the muscle edges right here, and those bands are called dynamic bands. And when the person smiles or talks or tenses up the neck, they become more visible. And those are the ones that facelift is just not good at getting rid of. At the same time, I don't think there is really a need to do anything else here. Those just areas very subtle and don't really make this patient look older.